I'd like to understand from the panelists as to what do you guys think that in your opinion are the impediments or barriers or challenges to implementing affordable healthcare. Can I start from Nilofer, please?
Thank you, Shagufta. Thank you so much, everyone. AIM Consulting, I think, once again, a very good work done by them. I have been attending these tech summits for 2 years now, and I think that they really open up your mind, and through this collaboration, a new direction, a new horizon is then evolved. So coming to your question very quickly, and I understand we have a shortage of time. So the barriers, I think we have been speaking about it since the morning. One thing that I would want to emphasize more upon that, the population that we have in this room and what our health minister also said is not Pakistan. So this is not what represents Pakistan. So that's the masses out there who does represent. So I think there are number of barriers that currently a common Pakistani faces. The first, if anyone would ask me, would be the awareness. Obviously, the awareness of a Pakistani regarding healthcare currently is very, very low. As I said, we don't represent Pakistan. We represent a class which is not representative of people out there. So awareness. So the facilities that they have is not Aga Khan. That is a common facility. That is a public healthcare unit that they go into. And they see healthcare as that unit who they go into, if they go into. That is also very important. So third, I would say accessibility. Accessibility of people to those locations is very, very poor. So I think awareness, affordability, accessibility, 3 A's for me are the barriers that a common Pakistani faces. Everything that we are speaking about, health tech, data analytics, going towards the next is what will follow. But I think the challenges are currently on a very, very basic level. And we, I think, as this audience sitting in the room, as this audience brainstorming, is the one who needs to find out the challenges of the basic problems. Once we have them, we can always build upon them. Thank you.
Thank you, Nilofer. I move on to Basir. I'm sorry, Basir. It was coming to my mouth as Basir. Basir, from the bank's perspective, what do you think are the challenges that are, the impediments to affordable healthcare from the bank's perspective?
Yeah, thank you. Because I feel a bit out of place here. Neither am I a technologist, neither am I a healthcare professional.
We shared that in
That's
comments.
right, that's right. But at least you work in healthcare.
Okay.
So, but no, I think let's go back a little bit and talk about, from a finance, as a finance professional, what do I think are the 3 basic the issues, right? So, in terms of affordable healthcare. Now, if you think back, whether you are talking about a patient journey, and right from access, awareness, diagnosis and treatment, or you are talking about making a pair of jeans available in the US from Pakistan, it really boils down to 3 things, right? One is access to capital, whether it's debt or equity. 2, it's efficiently deployed. And third is it is available to the patient or the customer at their convenience. So now if we look back at healthcare and say we look at Indus Hospital, so they've done a fantastic job. They've raised very cheap or donation capital, and they've deployed it very effectively for a patient in the southern district of Karachi. Now when we take this back to the bigger issue of the big challenge, to me it really comes down to 2 things, and this is a technology summit. So one is fragmentation, and the 2 is access. Now technology to develop is expensive, but to deploy across a country is fairly cheap as opposed to physical infrastructure, etc. But if we have a huge amount of fragmentation in our country, that becomes the biggest challenge. And the second is access. Now, of course, access in itself has various parts of it. I will only talk about financial access. So I think in terms of financial access, one is, of course, the high cost of debt or equity. Two, was the lack of subsidized financing. So there are ways to raise cheap financing, of course, through global, there are global organizations that give it. There's subsidized financing available in multiple terms. So that is there. And the third is the other ecosystem part, which is non-traditional capital, which is private equity and venture capital. So I think in terms of access, if you can address three of those things, and we'll talk about it later. But in terms of the challenges, I think that's where it boils down to.
Thank you, Basir. Thank you very much. From a banker's perspective, Alex, Arkan Health Services Pakistan works mostly in the rural areas in the countries where you operate. What, in your opinion, do you think are the challenges that are faced to affordable healthcare in the geographies where Arkan Health Services serves? And may I request that you restrict your response to the Pakistan geographies, because we are talking about Pakistan.
I'll try and do that. Thank you, Shagufta. As you said, I'm the global CFO for Arkan Health Services, and we operate in several countries. I've been very fortunate that actually I'm also a past AKU employee. I work with President Suleiman in actually doing the business plan in changing Nairobi to become AKU campus. But in terms of specifically your question, we as AKHS, because we operate at a very primary care level, our main thing is about population health and access, providing access to people, and therefore trying to see that we provide health care looking at the affordability of the population that we do serve. But I think that I want to step back to health economic perspective of why, when we talk about affordability and why we can't afford healthcare in Pakistan. And affordability means we should be able to pay for healthcare that we need. And the challenge that we do have in Pakistan mainly is what I call the funding challenge, that we don't have enough money, and the government doesn't have enough money to be able to fund all the healthcare that we need. The country doesn't have. And part of it is because we do have a very big informal sector that the government cannot raise funding from, because most of the population, about more than 50%, is informal. In addition to that, even the normal population, because of the cost of living crisis that we do have, we are struggling to actually put basic food on the table. And therefore, healthcare, when it comes to our need for healthcare, we can't afford to be able to pay for that. We also do have a problem of even lack of skills in the rural areas to enable the population to be able to access them. What happens is that it pushes people to go to much higher and higher cost facilities where they can find the clinicians that they need to be able to see. And that costs on average much more than that. I would come to a basic problem that I find for us in Pakistan. I count myself as part of it, is that we don't spend enough in healthcare. We spend on average about 3% of our GDP on healthcare, compared with about 8.5% on average globally. And therefore, we don't put enough actually in spending on healthcare. There are several reasons. I think I want to leave it at this because if I go on there, I can give back. But these, for me, some of the fundamental basic problems that we do have in terms of being able to have affordable healthcare.
So thank you, Alex. The one common theme that I heard, and I'm sure the audience heard, about affordability is the cost. And the cost comes from various factors, and what is happening across the globe, including Pakistan, is the high inflation and high interest rates, and which makes affordability of healthcare even more difficult. But what all of us saw as the biggest healthcare catastrophe of the century in terms of COVID, what people were saying generally was that now the governments will start investing, now there will be more investment in infrastructure as far as healthcare is concerned. But we saw that but we see that dwindling down. So my question to Nilofer is that keeping those impediments, that it is expensive, and because it is expensive, the affordability is compromised. So what do you think, as an insurance company, can any insurance company in Pakistan do to, with these barriers, create affordable healthcare that people can access?
Thank you, Shagufta, for that question. I think very relevant, because insurance, we most of the times forget, is a tool where pooling from many individuals happen. And if anyone think of it as a basic concept, I'll not touch the technical details of it, but as a basic concept, everyone pools in so that the people who are in need get the actual benefit of insurance. So that concept in itself, you would all relate to, and we have many forms. So we have insurance, and we also now have an Islamic variant of it, which is takaful. So when masses pool into that risk pool, the pool gets cheaper for everyone. So that's the basic concept of insurance, and that is a very important thing. But the problem again, when healthcare awareness, we all have just seen and we are seeing, is low, the insurance of awareness don't even ask. Right? That's our penetration. Our penetration is less than 1% of the GDP as insurance. So that's very, very low. But that is one very important tool that we all can follow. So insurance, and now what we as insurance companies are realizing more and more is that insurance has to go to the masses, and that's where every Pakistani can benefit out of it. So there was a time, I would say 6-7 years down the road, for every big insurance company, the target segment was middle income and above. But we have realized that in that way, we are losing out on a very big population. So it has to go that way. And when you go to the masses, it's very important to understand their needs, to create products, and which we have done as EFU. We have created products that are specially suited for that segment. So you have to understand, you would not have panel hospitals across the country. So you would have products that will reach and that will benefit the audience without those panel hospitals as well. You need to understand that clubbing important value-added services would create a value for them. So what value-added services? Tech, again, we are in a summit. Telemedicine is one thing that is playing a very important role, even though the utilization is still low, but it is increasing. It's increasing day by day. So value-added services such as telemedicine can be a very good add-on when it comes to reaching out to the population. And again, the cost is low. If people utilize it, many people subscribe into it, the cost is low. Then one more important thing towards which the world is moving when it comes to insurance is preventive and wellness concepts. So now you reward for good behaviors. You reward people if they maintain good behaviors, if they go for tests regularly, if they maintain healthy routines such as exercise, such as maintaining their daily step targets. That way, two things happen. The cost of insurance gets low, and obviously you have a healthy population. So insurance does play a very important role when it comes to affordability. The Sehat program that the government has introduced in Punjab, KPK, I think it's a great initiative. But what we really think is that the participation of private sector should also be there in addition to the public sector, in addition to the government sector, because obviously that's where everyone will learn, everyone will benefit from others' expertise, and everyone will grow. And that's what we need to think as a nation, that collaboration is very, very important. Without collaboration, without partnerships, without forums like these, organizations in various capacities, banks, health techs, health organizations, insurance companies coming together with the aim of helping the population, it will not happen. We are far away from competition. We are nowhere there. So nothing to worry about. So these were few points from my side.
Thank you, Nilofer. Very insightful. I'm just giving you one statistic of AKU. So AKU in Pakistan has 86% of our patients are self-pay, and 14% are either corporate customers or insurance company provided, which just shows the penetration of health insurance and the huge landscape available for penetration into this market. If we compare our hospital in Nairobi, it's the reverse. 86% of our patients are insured, and only 14% are self-pay. So there's a huge landscape, huge market, 250 million population. Whoever is the business entrepreneur sitting here, this is a huge market. We've experienced, the problem with health insurance has been the anti-selection. So only those people who need a knee transplant or some kind of procedure go for it. But there is a need to think on a massive scale. Basir, to you, from a bank's perspective, and since I'm seeing the clock at 4 minutes now, if you can just in 1 minute say that understanding that the inflation is high, understanding that the cost of capital is very high, if there is one thing that your bank would like to do to make healthcare accessible, what would that be for your bank in 2024? I'm sorry, I'm putting you on the spot, but there's just one intervention that you see the bank could do.
I mean, for example, yes, for example, we can provide capital. So we've done it for health tech startup. Ilaj has done incredibly well for insurance as well as telemedicine and e-pharmacy, et cetera. Two, of course, anytime we get cheap capital. So we got financing in COVID times. Also, we have cheap financing for solar for hospitals, et cetera. So that's where really, as bank, we're a channel. And of course, we are a channel partner to insurance in a huge way. And of course, discounts and alliances through partnerships.
All right, thank you. Alex, if there's one thing that HSP has in its goals for 2024, unless it's a big secret, could you share it with everyone?
I think our aim as HTS is to, as I said from the beginning, is to provide access at a lower level and at an affordable, sometimes heavily subsidized rate. And therefore, for Sindh, in particular, from Karachi and interior Sindh, we are in discussion with AKU about how we can integrate and provide seamless care and expand it into the rural areas as well, backed with technology. Since we have the tech, I shouldn't forget that we have the tech summit. So I think that is one of the aims of what we are trying to do in 2024.
All right. So creating access in Punjab and Sindh of affordable healthcare. That's excellent. Again, another very important aspect, what Nilofer touched upon, is access to technology. And during COVID, AKU, other than being the first hospital to introduce the test and the first hospital to admit a COVID patient, we actually launched a tele-ICU service. And the tele-ICU service was providing access to patients in the remotest parts of Pakistan. Doctors could not go there. Nurses could not go there. So concept of providing services to the massive using technology is one. The process of providing education to masses, healthcare professionals through technology. I think we have to think beyond the brick and mortar model to think about how does one reach to the patient. The patient necessarily does not need a hospital or a healthcare facility. So I think that technological advancement to make that access is important. But very important, one other thing that I'd like to mention here is the role of philanthropy in Pakistan. We saw during COVID that nobody died of hunger in Pakistan. Although people were jobless, industries were shut. You drive from here on Tipu Sultan Road, you will find a huge chunk of Selani. Philanthropy is one of the key aspects of making healthcare at least affordable for those who are not able to pay for their healthcare cost. Nilofer, in 30 seconds, if you can just tell me, what is the one thing that EFU Life will do in 2024 to make healthcare accessible?
So we are, as a strategic pillar, we are making wellness as a core part of our proposition. So what we will do in 2024 is generate a lot of content, because on the awareness part, we feel that content creation will really and reach to them in their language and in their way in which they will understand things.
Thank you. And people must be thinking that I've asked Aga Khan Health Services, I've asked JS Bank, I've asked EFU and not talked about Aga Khan University. So for Aga Khan University, we have a very generous patient welfare program. And just letting you know that our spending for 2023 was 6 billion rupees. 6 billion rupees, 5.5 has already been spent. And although it's a very difficult time, we've put 6 billion rupees further, rather 6.6 billion rupees further in the 2024 budget to ensure that the access to healthcare continues. In addition, for those of you who may not know, on our laboratory network, on the 300 lab network that we have, patient welfare is available at over 240 laboratories. And if a patient is Zakat Mustahiq, they can receive welfare up to 60% at some locations and at 80% at some other locations. So AKU is also trying to ensure that we are able to create access to those who are not able to afford quality health care at their doorsteps. So going closer to them and ensuring that cost, if it can't be reduced, how does one bring corporate social responsibility and philanthropy in that same envelope to make healthcare affordable? Thank you. Do we have a couple of minutes for questions or no?
No, we can absolutely.
Right.
Anybody have any questions? We can take one question, yes.
Oh.
On. Sorry, we can take one question from there. Can we quickly give this gentleman a mic, please?
Hello, thank you. Such a wonderful discussion. My name is Amish Shaukat, and my question would be toward Nilofer that, in my humble opinion, it is not about awareness due to which the insurance penetration is very less. It is about affordability, right? And this will always go on because right now, considering inflation, cost of living, people cannot spend on health insurance. So how you as an EFU and other companies who are working on the commercial terms will bridge this gap? Because unless and until there is something related to cost, this bridge can never be crossed. Government is doing something, but that's specific to Punjab or Sehat card, but it's not at the mass level. Even for people like us who are insured are generally people who are employed somewhere or well educated, but that's very little. So I would like to know your thoughts, how you as a company would play a role over here. Thank you.
Thank you very much. Yes, Ms. Nilofer.
Thank you so much. I think a valid question. And again, I would say that affordability, yes, to some extent, I would agree that that is a problem. But as I said, we have come a long way. But again, I will return to awareness because people don't know. So do people in this room know that we have health insurance for as low as 2 rupees a day? Do people know? Anyone? But yes, we have. We have those plans. We have health insurances for annual 2,000, 3,000 rupees a day and very affordable health insurance. And again, as I said, the health insurance that is acceptable to all hospitals. Any hospital that is registered as a hospital in Pakistan, it is available to them. So yes, we are evolving, we are changing every day. As I can talk about my company, as the FU Life, 5 years down the road, we established this inclusive insurance pillar. So that is a mass market insurance pillar that we established. And our core was that if we want to go to the masses, we can't have products of, say, even 75,000 or 100,000 rupees a day. We have to have these small products, and then again, for them to be successful, it is very, very important that people actually utilize that. So what we do is, we actually appreciate claims, which is very little, right? You would hear a lot about, as Shagufta just said, anti-selection and lot of claims happening, but that's not how it is. People, yes, as Pakistanis, we do a lot of research and there is an element of cheating, but not everyone does that. There are very less claims. So yes, products are being developed according to the needs of the masses. The issue is that the more more and more efforts need to be done to continue this. This doesn't has to be a one-time activity. We have to continue this. We have started. There is a long way to go, and I am very hopeful that from the success that we are getting from the initial days, we have a lot of potential lying there, and it will further be affordable if the trend continues. Thank you.
Thank you very much. Thank you so much, everybody.